Are you at risk of liver damage? Well, if you're over 30, overweight, or over 40, then chances are you could be suffering from fatty liver disease and you may not even know it. In fact, fatty liver disease is now affecting up to 25% of Americans, which is up to 80 million people. However, most people don't know they're at risk for it because there are no symptoms. They only find out when it's too late and they have cirrhosis. Cirrhosis is where the healthy liver becomes scarred and replaced with scar tissue, making it harder for your liver to remove toxins and produce bile to help you digest fats. Fatty liver disease can lead to more serious conditions such as non-alcoholic steatohepatitis, non-alcoholic cirrhosis, and even liver cancer. Fortunately, you can protect yourself by being aware of the hidden causes that can silently damage your liver. So let us talk about this one daily habit that could be damaging your liver and what you can do to prevent it. First, let's take a look at how you develop a fatty liver in the first place. The liver has the important job of filtering out toxins from the blood and producing bile to help you digest fats. Bile is made by the liver and stored in the gallbladder. When you eat, the gallbladder releases bile into the small intestine where it helps break down fats. But bile also contains something called bilirubin, which gives it a brown color. Sometimes the liver can get damaged and the cells start to die. This releases a large amount of bilirubin all at once into the bloodstream. Bilirubin is water-soluble, so it can build up in the body and cause jaundice, which is a yellowing of the skin and whites of the eyes. Jaundice is a sign that something is wrong with the liver. It's like the liver is trying to tell you that it needs your attention. But unfortunately, most people ignore these signs until it's too late. The truth is the liver is an amazing organ that can regenerate itself if given the right conditions. But if we keep feeding it the wrong things, it will eventually reach its limit. One condition that can occur is known as non-alcoholic steatohepatitis or NASH. With fatty liver disease, fat builds up in the liver causing inflammation and cell damage. This leads to scar tissue forming in the liver called fibrosis. If this continues, the liver becomes unable to function properly and this is known as cirrhosis. Cirrhosis can lead to liver cancer, which is the second leading cause of cancer deaths worldwide. Now let's take a closer look at the one daily habit that could be damaging your liver. And number one is drinking too much alcohol. Alcohol is one of the most common causes of liver disease. Drinking too much can cause inflammation and cell death in the liver, leading to scar tissue and fibrosis. Long-term heavy drinkers are also at risk for developing a condition called alcoholic hepatitis. Alcoholic hepatitis is a severe inflammation of the liver caused by long-term heavy drinking. People with alcoholic hepatitis often have a high white blood cell count, jaundice, fever, abdominal pain, and swelling in their legs. This means that fluid is backing up into the legs because the liver is no longer functioning properly as a pump. If left untreated, alcoholic hepatitis can lead to cirrhosis and liver failure. Unfortunately, the only way to prevent alcoholic hepatitis is to stop drinking alcohol. There is no cure for alcoholic hepatitis and treatment is mostly supportive care. Doctors may recommend a liver transplant in severe cases. However, it should be noted that you do not have to be an alcoholic to suffer from alcohol-related liver disease. Even moderate drinking can cause liver damage over time. According to the American Journal of Medicine, moderate drinking is defined as up to 2 drinks per day for men and 1 drink per day for women. Next, we have non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is becoming more common and is likely due to a combination of factors, including obesity, high fructose corn syrup consumption, and lack of physical activity. People who are obese have a higher risk of developing fatty liver disease because excess fat is stored in the liver. Fructose consumption is also associated with fatty liver disease. When the liver breaks down fructose, it produces a compound called uric acid. High levels of uric acid in the body can lead to inflammation and cell death in the liver, resulting in fibrosis. Finally, physical activity may play a role in the development of fatty liver disease. Studies have shown that people who are less active have a higher risk of developing the disease. This may be because exercise helps improve insulin sensitivity, which in turn reduces liver fat. Another thing that can cause liver damage is taking too many over-the-counter pain relievers. Acetaminophen, also known as paracetamol in some countries, is a popular over-the-counter pain reliever. Taking too much can cause liver damage, inflammation, and cell death. In severe cases, this can lead to liver failure. According to the American Association of Poison Control Centers, more than 100,000 cases of acetaminophen poisoning are seen in U.S. emergency departments each year. Most of these cases are due to people taking too much of the medication. It's important to read the label and follow the recommended dosage on any medication. Another culprit is viruses. Viral hepatitis is a type of liver inflammation caused by a viral infection. There are 5 main types of hepatitis viruses: A, B, C, D, and E. Each type is caused by a different virus and has different symptoms. Some types of viral hepatitis are acute, meaning they come on suddenly and last for a short time. Other types are chronic, meaning they last for a long time and can cause serious liver damage over time. For example, hepatitis B and C are the most common causes of chronic hepatitis. Chronic hepatitis can lead to cirrhosis and liver cancer. Vaccines are available for hepatitis A and B, but there is currently no vaccine for hepatitis C. Treatment for viral hepatitis depends on the type of infection. In some cases, there are medications that can help fight the virus and reduce liver inflammation. However, there is no cure for all types of viral hepatitis. Toxins are another major cause of liver damage. Toxins are harmful substances that can damage the liver. Exposure to toxins can occur through a variety of routes, including inhalation, skin contact, and ingestion. For example, inhaling toxic fumes or vapors can cause respiratory damage and lead to liver inflammation. Skin contact with certain chemicals can also lead to liver damage. Ingestion of poisonous substances is another route of exposure that can result in liver damage. People who work in certain occupations, such as firefighters and chemical plant workers, may be at increased risk for exposure to toxins. In addition, people who live in areas with high levels of air pollution may also be at risk. The next thing we need to discuss is metabolic disorders. Metabolic disorders are diseases that affect the body's ability to process food and use energy. These disorders can lead to the buildup of harmful substances in the body, which can damage the liver. One example of a metabolic disorder is Wilson's disease. Wilson's disease is a rare genetic disorder that causes copper to build up in the body. Copper is normally processed by the liver, but in people with Wilson's disease, the liver is unable to get rid of copper effectively. As a result, copper can build up in the brain, eyes, and other organs, causing serious damage. Symptoms of Wilson's disease include tremors, stiffness, difficulty speaking, and jaundice. Treatment for Wilson's disease involves removing the excess copper from the body. Medications that bind to copper in the body can help reduce copper levels. Finally, autoimmune disorders can also damage the liver. Autoimmune disorders occur when the body's immune system attacks its own tissues. In autoimmune hepatitis, the immune system attacks the liver, causing inflammation and cell death. This can lead to scarring in the liver, which is called cirrhosis. Symptoms of autoimmune hepatitis include fatigue, jaundice, abdominal pain, and swelling in the legs. Treatment for autoimmune hepatitis includes medications to suppress the immune system. These medications can help reduce liver inflammation and prevent further damage. So, what can you do to protect yourself against these causes of liver disease? First, you must avoid alcohol altogether. If you're pregnant, please talk to your doctor about safe amounts of alcohol consumption. Don't take more than 3 grams of acetaminophen a day. And if you're taking other medications that contain acetaminophen, be sure to read the labels carefully. Also, you need to eat a balanced diet, exercise regularly, and maintain a healthy weight. And finally, get vaccinated against hepatitis A and B by following these simple steps. You can help keep your liver healthy and reduce your risk of developing liver disease. Thanks for watching.